Hello, hi, I'm Walt Mills. I'm the program director, and we wanted to just produce this brief video to give you a brief overview of our new program. With the intent is to give medical students who are considering joining our second class up some updated information to supplement what's already on our website. I highly encourage that you take a look at the existing videos that include a broad overview, information about our wellness program, information about our diversity, equity, inclusion, and belonging program. I'll go a little bit into it during this video. In this one, what we want to do is try to address the frequently asked questions so that you can discern whether our program aligns with what you're looking for in a residency. So while it may not be an FAQ, it certainly is the most important piece, and that is, what is our mission? It's to comprehensively train family physicians who are well-prepared, humbly competent, and probably most importantly, happy to pursue careers dedicated to advancing health equity for all who we serve. We say we aim to train pluripotential selves who can differentiate themselves upon graduation to serve any community that you're called to. Locally, we hope some decide to stay here, or nationally or globally. Now, if that mission aligns with yours, we'll go into some of the details, but want to just lead out with the fact that we follow evidence-based approach using master adaptive learning, which is a cutting-edge practice in competency-based medical education. Now, I'm not going to go into detail on those particular tools, but I recommend you look them up and get familiar with them. But the important thing is that they and other aspects are intentionally integrated into our program with the intent of creating a positive, effective, fun clinical learning environment. It's such an important time in your life. You want to be in an environment that supports you in this incredible 3 years of professional and deep personal development. So perhaps the second question might be, we're new. So why would anybody think about joining a new residency? We started our first class in June of 2024, just recently. And a testament is that we've been very fortunate that despite being the only residency in the entire county, we have over 100 faculty who have stepped forward. Actually, last week I counted 125 faculty representing every specialty required to support a robust program of excellence. Those faculty have over 200 years of GME educational teaching experience collectively. We've already had medical students from our sponsor, Morehouse School of Medicine, from Stanford, from Thoreau College of Osteopathy. The clinical learning environment is very positive thus far, with the intention to have it just get better. And one piece of that is embracing the values, the 5 values that I'm going to go over of common spirit health. Collaboration is the first. Who wouldn't resonate with that? We want to collaborate between the preceptor and the resident, between the residents, between other peers, between all of our other stakeholders and our patients. Innovation. We don't just want to settle for average or for being compliant with ACGME requirements. We have our North Star being to be a path to being a program of excellence, which will take a lot of really wonderful residents to help create that path. I think excellence is very important, yes, but probably the most important of all these values is compassion. That is, translates to love in action. And then following that is the value of inclusion. That is, you want to be in a space, in a place where you feel and experience belonging. And you want to be with others who also belong. I did mention the DEIB committee, which is charged with ensuring that the equity lens is used for everything we do. Now, that's faculty selection and development, the folks who are going to be working with you. It's our curriculum. It's our evaluations. It's our individual learning plans. And as per the focus of this video, how do we do resident recruitment and selection? We seek candidates who resonate with our mission, as I alluded to, and the values, which I went over. We'll be excited, energized, fulfilled when in our training program. That's who I want to be with. We employ specific structured interview processes that are evidence-based ways of having non-biased, equitable ways of doing the interview and of selecting. We had great feedback from last year's interviewees regarding human kindness, which is another value here that was employed in the interviews, which if you visit, we hope you experience. And if you do interview here, I will send you actually the structured questions in advance so you don't feel surprised, but rather you have a chance to feel supported and be your absolute best. Now, the fourth area to cover is, yes, I mentioned to be a program of excellence takes a lot of additional support to reach beyond mere accreditation. We've been blessed by Morehouse School of Medicine, Common Spirit Health, and a dozen other Santa Cruz County institutions who together have fashioned a rather unprecedented curriculum. This includes strong experiences in inpatient medicine, surgery, orthopedics, sports medicine, emergency medicine, intensive care, palliative care, acute rehab, psychiatry, behavioral health. That's all at Dominican Hospital, as well as a variety of other strong electives. Now, a major partner is Santa Cruz Community Health Center, a federally qualified health center, and we have 3 FQHCs who have partnered with us. Our continuity clinic is at Santa Cruz Community Health Center, 5 minutes from Dominican. They built a whole new building for the residency continuity clinic, and that provides advanced experience in team-based care, outpatient addiction medicine, integrated behavioral health, Chinese medicine, including acupuncture, chiropractic, chronic pain, osteopathy. We have strong procedures and focus point-of-care ultrasound curriculum that starts in your orientation with workshops and then is integrated intentionally into all our core curriculum in your continuity clinic. Now, here's evidence that we have support to seek excellence. All of our residents get a GE V-scan probe when they arrive that you keep for your 3 years. So you truly can learn how to develop and be credentialed in this 21st century stethoscope, i.e. point-of-care ultrasound. It's fun, it's a win for the patients, it's great for education, and it's one of the most powerful ways to mitigate healthcare disparities. In addition, you'll have basic procedures that are provided, as well as advanced ones like colposcopy, advanced skin surgery, including tattoo removals, joint injections, and then a long list of inpatient and outpatient procedures. We have a dedicated month, as I mentioned, of focus and procedures. The clinic is currently the only FQHC in California to provide medical abortion. There's a few that are on the brink of doing this, but that's out of dozens and dozens in the entire state, and very telling about the commitment to the mission and the ability for you to have that be part of your clinical learning experience. For those who wish to have advanced abortion training, this can be arranged as we're members of READY, that's Reproductive Health, Education, and Family Medicine, to provide abortion training. Another major partner is Watsonville Community Hospital, the other hospital in the county. There's only 2. In partnership with Salud para la Gente, the other FQHC that I alluded to, in the South County of Santa Cruz, where predominant patient population served are Latinx, many farm workers, with the majority Spanish speaking. You spend 6 months in your first 2 years doing an integrated inpatient, outpatient rotation in pediatrics, OB, and GYN that we call family-centered POG, P-O-G, Peds, OB, GYN. Your inpatient pediatrics is taught by Stanford Pediatric Hospitals. The OB-GYN is taught by OB-GYNs, of course, nurse midwives, which is not that common, and family physicians doing OB. So you have good role models and support. Now, given the Spanish proficiency to meet our mission, we have provided a medical Spanish proficiency program with the goal of each graduate being competent. So even those who may be native or fluent speakers can benefit by this program, let alone those who have beginning or middle expertise. So the intent is to provide a structured, well-supported environment for everyone to actually be able to be credentialed as interpreters. Now, the last couple things to mention are two big areas that are unique to our program. First is osteopathy. We are the third program in California to be certified by the ACGME in osteopathy. That's out of nearly 80 family medicine residency programs. Design of our program is osteopathic medicine for the underserved, very intentional, and provides advanced training for DOs. And here's an important nuance: basic training for all of our allopaths, all our MDs. So everyone is familiar with osteopathic practices and principles because it fits with our mission of being holistic and being able to address in evidence-based ways the mind, body, and spiritual aspects of being a healer and helping others. Those MDs who wish to pursue more advanced training are also able to do so. Our second piece is our fact that in California, we're the only program, and there's only one other one in the country as far as we know, where you can become certified in functional and integrative medicine. Again, the program is designed for the underserved. We call it integrated functional medicine for the underserved, with the idea being to eliminate health access challenges such that upon graduation, you'll know how to provide integrated and functional medicine anywhere, regardless of resources. Lastly, there are many opportunities for you to design your own tracks and advanced training in everything from addiction medicine, I'll name a few, sports medicine, geriatrics, behavioral health, advanced obstetrics, dermatology, community medicine, leadership and advocacy, as well as opportunities and support for you to design your own track to meet your professional interests with 6 months of elective time. We call them selectives in your last 2 years. By the end, you'll be qualified essentially to attend any fellowship you pursue. In fact, it's very likely with our own development, by the time you graduate, we'll have a few of our own fellowships to consider. All right, hopefully this is helpful. Wish you well, and we want to thank you for considering family medicine as a way to make the world a better place.